Hi everyone, it's Dr. Pauline from Arc of Life, Chiropractic and Massage in Ottawa, and we're going to talk today about things that you can do if your baby might be in the suboptimal position, being in a breech position. A lot of women are referred to us by their OB or by their midwife if they find out that the baby, again, might be in breech position. So certainly we're going to talk about Webster's technique, which is extremely effective, not on turning a breech baby, but more so what we're looking at. All of these things we're going to talk about today are about creating proper movement within the spine, proper alignment of the pelvis to allow for the baby to move to a better position for them, whatever their best position is. Okay, so instead of like trying to physically again force the baby into the position, instead, why is the baby in that position in the first place? Why is the baby not head down? Oftentimes it's not uncommon for the pelvis or the sacrum to be misaligned with the looseness in the ligaments that happens throughout pregnancy to allow for birth, but a lot of us are in sedentary positions and are not moving as much as we should, so sitting too long. So those positions again can create more likelihood of having misalignments in the pelvis that can constrict the proper positioning of the uterus and therefore then proper positioning and room for the baby to then head down. All right. So a few things to keep in mind if you do find out that around again 32 weeks or beyond that baby may be breech. You want to avoid the deep squat. Definitely working on an exercise ball is a great idea, but just don't go to a deep squat because you don't want the baby to engage in that position until you know that they're head down. The other thing is to increase your water intake. Really important not only to keep yourself hydrated, but also for the baby, right? So for your ligaments and your muscles to be, again, allowed to move and to relax, but also keeping baby in a lot of fluid. You don't want to allow for more likelihood of a preterm labor. So again, keeping well hydrated, about at least 62 ounces a day, 3 good water bottles is a good judgment to use. The other thing is when we're looking at Webster's technique, we're looking at 2 things. One thing is proper pelvic alignment of the pelvis and the sacrum. The other thing is also decreasing the tension along the round ligament. This is what's supporting the uterus. So both of these things within Webster's technique that you need to make sure that you see a chiropractor who is trained specifically in Webster's and deals with a lot of pregnant women. This will allow, again, for removing any obstacles that might be in the way and allowing a lot of room for the baby to then hopefully again head down. One more thing that you can do is also get in the pool. So front crawl position is great if you want to do some like dives from when you're in the pool and just diving down or doing some forward somersaults. All really great ideas. And if that just seems maybe a little bit too much, then also just getting the pool for movement, some light bouncing is again good encouragement for the baby to move around. Okay, so we're going to show 3 of the top exercises that we really like as well, that if your baby is in a breech position, this is taken from spinningbabies.com. They're a wealth of knowledge, the website's amazing, but it is a lot of information. So this is just going to pare it down into just demonstrating 3 of the top exercises that we like if you're in a breech position. So Julie's going to help us out today. The first one we're going to show is a knee chest position. So you're going to get on your knees, and then you're going to go ahead and come down where your forehead is down onto the floor, and really just letting the baby kind of in the belly to hang down. You can do this in this position, holding for anywhere between 5 to 15 minutes, and you want to do this about 3 times a day. Okay. The next position is going to be similar to the knee chest, but it's going to be just a little bit more extreme in the angle. This is called the forward leaning position. So you want to use a really sturdy chair. You're going to get up on your knees here. With some help, make sure that there's a partner around to help you. And you're going to come down there in that position. Now this one, again, you want to make sure that you tuck your chin in so that it's nice relaxed into the pelvis. You can hold this for up to about 30 seconds, not longer than that. And the key on this is actually to be doing it about 3 to 4 times a day. Don't hold it for longer and think that you get all in one shot. Do the 30 seconds, 3 to 4 times a day. Okay, great. Here. And the last exercise or stretch that we're going to do. Now, there's a couple ways you can do this. Sometimes you can do this like on a couch and have like a piece of plywood. You might have a long patio chair that you have as well too. That's like kind of a long sturdy board that you can use. on, again, a nice sturdy chair. And so this one is a breech tilt, is what it's called. So you're going to get up. Nice to hook into your knees like that. I'm going to grab a pillow for Julia here. Awesome. Good, so about a 45-degree angle is kind of what you're looking for. And then in this position as well too, just make sure that you're nice and locked in, that you've got, again, good sturdy support and that someone's nearby to help you up. And as well with that, you want to be doing that. You can lie in this position for about 10 to 15 minutes. Okay, so that's the last position that we wanted to show you. I'm going to just help you up in this position here. Perfect. Great. And so if you have any questions, feel free to contact us through our website at archivelife.ca. See you next time.